Imagine if your own mind started playing tricks on you. If the line between what's real and what's not just got blurry.
Yeah, it's a really profound experience, and that's the world for many people living with schizophrenia.
And that's what we're diving into today. Schizophrenia. It's serious, obviously, but so often misunderstood.
Definitely. Our goal here is really to unpack it, get past some of the myths.
Exactly. We want to shed light on why understanding it matters for everyone. We're using insights from schizophrenia, understanding the mind's unseen battles, and also that great TED Ed talk by Anees Baji.
Both excellent resources.
So get ready, because we're going to try and cut through some of that noise, get a clearer picture of a condition that affects so many people, often quite silently.
And one that still carries, unfortunately, a huge amount of stigma.
Right. So where do we start? Maybe with what it isn't, because that seems to be a big point of confusion.
Absolutely. Let's hit that head on. Schizophrenia is not split personality, not multiple personalities living in one body. That's a completely different thing, despite the popular mix-up.
Okay, super important distinction. So if it's not that, how do the sources define it? What's the core issue?
The core issue is fundamentally the brain having trouble telling what's real and what isn't.
Okay.
And that, as you can imagine, affects everything how a person thinks, how they feel, how they behave. It's a disruption of their thought processes.
Not another person taking over.
Not at all. And another key thing, it's considered a syndrome.
Right, I saw that. What does that mean practically?
It means it's likely an umbrella term. It probably covers a number of related disorders that, well, they share similar symptoms, but the underlying causes might differ quite a bit from person to person.
That makes sense. It explains why it looks different in different people.
Exactly, and it highlights why treatment has to be so individualized.
And it's been recognized for, what, over 100 years?
Yeah, over a century. And yet,
we still don't know the exact causes?
Largely no.
Yeah.
We know a lot more, but the precise why is still elusive, which is, frankly, quite humbling.
It really is. So this variability, this syndrome idea, it leads us straight into the symptoms themselves. When does it typically start?
Onset is often in late adolescence or early adulthood. Generally, a bit earlier for men, late teens, early 20s.
And for women.
A bit later, often late 20s or early 30s.
But the very first signs can be easy to miss, right? They're subtle.
Very subtle sometimes. Things like gradual changes in personality, maybe becoming more irritable, withdrawn, or maybe some unusual thoughts start creeping in, but not in an alarming way initially.
So it might just seem like teenage angst or stress at first.
It could, yeah. Diagnosis often doesn't happen until psychosis sets in. That's when the more pronounced symptoms become clear.
Okay, let's talk about those symptoms. The sources break them down into positive, negative, and cognitive. Starting with positive, that word sounds odd here.
It does, doesn't it? Positive just means symptoms that are added to experience, things that aren't typically there.
Like hallucinations.
Exactly. Hallucinations are common, especially auditory ones, hearing voices that others don't.
That's the one most people probably think of.
It is. And then there are delusions. These are really strong fixed beliefs that seem absolutely real to the person, but they aren't based in reality.
Like believing they're being watched or have special powers.
Precisely. Persecutory or grandiose delusions are common examples. And you also see disorganized thinking, which can come out as jumbled speech or disorganized behavior.
So all things that are present but shouldn't be?
Right. Indicating a disruption in how thoughts are processed. Again, not a different personality.
Got it. Now, what about the negative symptoms? These are things that are missing.
Exactly. Qualities that are reduced or absent compared to usual functioning. This could be things like social withdrawal, pulling away from friends, family, a real lack of motivation, sometimes called avolition, difficulty focusing, or what's called flat affect, a reduced expression of emotions in the face or voice, limited speech too.
And these can be just as difficult to deal with, right? Maybe even more insidious.
Absolutely. They profoundly impact someone's ability to, function day to day, hold a job, maintain relationships, engage in hobbies. They can lead to a lot of isolation.
And then quickly, the third category, cognitive symptoms.
Yeah, these affect thinking processes directly, difficulty with concentration, with memory, especially working memory, like holding information in mind, and with executive functions, like planning and making decisions.
So a really complex picture. Positive, negative, cognitive, all potentially intertwining.
It's a very complex picture, which leads us to the big question. Why? What causes all this?
The sources point to a mix, don't they? Not one single thing.
No, definitely not a single cause. It's understood as a combination of genetic predisposition and environmental risk factors.
Let's talk genetics first. The link seems pretty strong.
It's one of the strongest genetic links for any psychiatric illness, actually. So the general population risk is about 1%.
Okay, 1 in 100.
But if you have a parent or sibling with schizophrenia, your risk jumps up about 10 times higher.
10 times? Wow.
And for an identical twin, if one twin has it, the other has roughly a 40% chance.
40%. That's massive. But it's also not 100%.
Exactly. Which tells us genetics isn't the whole story. It plays a big role, likely involving multiple genes interacting in complex ways we don't fully grasp yet.
So the genes load the gun, so to speak.
And environment might pull the trigger. That's a common analogy, yeah.
What kind of environmental factors are we talking about?
Well, things like exposure to certain viruses, maybe even before birth or in early infancy. Complications during pregnancy or birth have also been linked.
And drug use. I know that comes up a lot.
Yes, the use of certain drugs, particularly during adolescence or early adulthood, seems to be a risk factor. Cannabis use, for instance, especially heavy use of high-potency strains, has been associated with an increased risk of psychosis, particularly in those already genetically vulnerable.
So it's not causing it out of the blue, but maybe triggering it in someone predisposed?
That seems to be the thinking, yes.
Yeah.
It's about the interplay. Someone with low genetic risk might tolerate environmental exposures without developing the illness. Someone with high genetic risk might develop it with only moderate environmental stress.
It's a complex equation for each person.
Very much so.
So this mix of genes and environment, how does it actually change the brain? What's going on chemically or structurally?
That's the next layer. And interestingly, our understanding here has been helped a lot by studying how treatments work.
Oh, right. Like the antipsychotic drugs. The sources mentioned they mainly block dopamine receptors, the older ones anyway.
Exactly. That led to the dopamine hypothesis.
Yeah.
The idea is that an imbalance in dopamine signaling is key.
An imbalance how? Too much, too little.
Well, here's the twist. It seems like the positive symptoms, the hallucinations, delusions, are linked to an excess of dopamine activity in certain brain pathways, like the mesolimbic pathway.
Okay, too much dopamine causes those.
Potentially, yes. But, and this is crucial, the negative and cognitive symptoms might actually be linked to too little dopamine activity in other areas, like the prefrontal cortex.
Wow. So too much in one place, too little in another.
That seems to be part of the puzzle. It makes treatment incredibly tricky because you're trying to correct both imbalances, potentially with the same drug.
No wonder finding the right medication can be such a challenge.
Precisely. And it's not just dopamine. Newer antipsychotics target other neurotransmitters too, like serotonin, suggesting the picture is even more complex.
The sources also mentioned something about brain structure, actual loss of neural tissue or atrophy.
Yes, some studies show differences in brain structure, like slightly enlarged ventricles or reduced gray matter volume in certain areas in some individuals with schizophrenia.
Is that the disease itself causing that, or maybe the medication?
That's a really important question, and honestly, the jury is still out. It's hard to disentangle the effects of the illness itself from the long-term effects of medication, or even factors like substance use or lifestyle. It could be a combination.
So a lot we're still learning there.
Definitely. And of course, these medications, because they affect neurotransmitters systemically, can have significant side effects. Weight gain, metabolic issues, sedation.
Which adds another layer of difficulty for people managing the condition.
Absolutely. It's always a balance.
Okay, so given all this complexity, the varied symptoms, the tricky brain chemistry, the side effects, what does recovery look like? Can people live well with schizophrenia?
Yes. Emphatically, yes. That's probably the most important message. With the right treatment and support, people with schizophrenia can, and absolutely do, lead stable, fulfilling, meaningful lives. Recovery is possible.
That's really hopeful. What does that right treatment usually involve?
It's typically multifaceted. Medication, usually antipsychotics, is often a cornerstone to manage the symptoms, especially psychosis.
But not just medication.
No, definitely not. Psychosocial therapies are critical. Things like cognitive behavioral therapy, or CBT, adapted for psychosis, can help people develop coping strategies for symptoms like voices or unusual beliefs.
Okay.
Family therapy is also really important, helping families understand the illness and support their loved one. Social skills training, vocational support, it's really about treating the whole person.
The sources also mentioned ECT, electroconvulsive therapy. That sounds Intense.
It does, and it has a controversial history. But modern ECT is safe and can be very effective, especially for severe symptoms or when medications aren't working well enough. It often provides more rapid, though sometimes shorter-lived, relief.
And timing matters, right? Getting treatment early.
Hugely important. The evidence suggests that the longer psychosis goes untreated, the harder it can be to manage long-term. It's like the pathways get sort of embedded. Early intervention leads to better outcomes.
Which requires recognizing the signs and having access to care.
Exactly. And that's where support comes in from family, friends, the community. That support system is vital.
Which brings us, inevitably, to stigma. It feels like this huge barrier hanging over everything we've discussed.
It absolutely is. The stigma surrounding schizophrenia is immense and deeply dehumanizing. It prevents people from seeking help, isolates them, and creates this environment of fear.
And often based on misconceptions like the idea that people with schizophrenia are inherently dangerous.
Right, which is statistically just not true. People with schizophrenia are far, far more likely to be victims of violence than perpetrators.
That's such a critical point.
It is. And when violence does occur, it's often linked to untreated psychosis or substance use, like in the general population. Proper treatment actually reduces any risk.
So what people need isn't fear, it's
understanding, empathy, support. They're not crazy. They're human beings dealing with a complex brain disorder, individuals with hopes and dreams and talents just like anyone else.
How do we foster that understanding?
Education is key. Educating ourselves, patients, families, healthcare providers, the wider community. Challenging myths when we hear them. Sharing accurate information.
Because mental illness isn't a character flaw.
Not at all. It's not a weakness. It's a health condition, a part of the human experience for many, and recovery in various forms is achievable.
So we've covered a lot today, really trying to unpack schizophrenia, moving past those myths about split personalities.
Yeah, looking at the real symptoms, positive, negative, cognitive.
Understanding that complex mix of genetics and environment.
The brain chemistry, the dopamine puzzle.
And crucially, the pathways to treatment and the real possibility of recovery.
And the desperate need to break down that wall of stigma.
Absolutely. Which leads to a final thought for you, our listeners. We know schizophrenia affects roughly 1 in 100 people globally. We know early help and community understanding are critical. So thinking about that, what responsibility do we have as individuals, as communities, to really create spaces where reaching out for mental health support isn't just okay, but is actively encouraged? How do we truly help dismantle that stigma?